Hello everyone, now let us discuss about Health Insurance Portability and Accountability Act Part 2. Now first of all, let us see what are covered entities. The following types of individuals and organizations are subjected to privacy rule and considered covered entities. The first category in covered entity is healthcare providers. Every healthcare provider, regardless of the size of practice, who electronically transmits health information in connection with certain transactions. And these transactions include claims, benefit eligibility inquiries, referral authorization request, and other transactions for which HSS has established standards under the HIPAA transactions rule. The next class under covered entities are health plans. The health plans include health, dental, vision, and prescription drug insurers, health maintenance organizations, HMOs, Medicare, Medicare Plus Choice and Medicare Supplement insurers, long-term care insurers excluding the nursing home fixed indemnity policies, employee-sponsored group health plans, government and church-sponsored health plans, and multi-employer health plans. An exception is a group health plan with fewer than 50 participants that is administered solely by the employer that establishes and maintains the plan is a not covered entity. Group health plan is covered entity, but a group health plan with fewer than 50 participants that is administered solely by the employer that established and maintains the plan is not a covered entity. The next are healthcare clearinghouses, entities that process non-standard information that they receive from another entity into a standard, that is standard format or data content or vice versa. In most instances, healthcare clearinghouses will receive individually identifiable health information only, and when they are providing these processing services to a health plan or healthcare provider as business associate. So healthcare clearinghouses are also considered as covered entities. What is their function? They process the non-standard information that they receive from another entity into a standard data, standard format or data content. Next are business associates. They are also considered as covered entities. A person or organization other than a member of covered entities workforce using or disclosing individually identifiable health information to perform or provide functions, activities or services for a covered entity. And these functions, activities or services include claim processing, data analysis, utilization review and billing. These business associates are also considered as covered entities according to HIPAA. Now coming to permitted uses and disclosures. The law permits but does not require the covered entity to use and disclose PHI without an individual's authorization. It does not use or disclose PHI without an individual's authorization. It compulsorily requires an authorization by the individual. The following are the purposes or situations. The first thing is disclosure to individual. If the information is required for access or accounting of disclosures, the entity must disclose to the individual. Next case is treatment, payment and healthcare operations. The next is opportunity to agree or object to disclosure of public health information. For example, an entity can obtain informal permission by asking the individual outright or by circumstances that clearly give the individual the opportunity to agree, acquiesce or object. The next is incident to another otherwise permitted use and disclosure. And next situation is limited data set for research, public health or healthcare operations. The next case is for public interest and benefit activities. The privacy rule permits use and disclosure of PHI without an individual's authorization or permission. For the public interest and benefit activity, authorization is not required. For the 12 national priority purposes. What are those 12 national priority purposes? The first one is when required by law, when the information is required by law. and for public health activities, for victim of abuse or neglect or domestic violence, and for health oversight activities, for judicial and administrative proceedings, and for law enforcement, functions such as identification concerning the deceased persons, for cadaveric organ, eye or tissue donation, research under certain conditions, and to prevent or lessen a serious threat to health or safety. If the information is required for essential government functions, and if it is for workers' compensations. For all these cases, individual's authorization or permission is not required to disclose the protected health information. Now, coming to HIPAA security rule. While the HIPAA privacy rule safeguards HPI, the security rule protects a subset of information covered by the privacy rule. This subset is all individually identifiable health information a covered entity creates, receives, maintains, or transmits in electronic form. This information is called Electronic Protected Health Information or EPH. The security rule does not apply to PH transmitted orally or in writing. EPH is governed by security rule. And to comply with HIPAA security rule, all covered entities must ensure the confidentiality, integrity and availability of all EPHI, that is protected health information, detect and safeguard against anticipated threats to security of the information, protect against anticipated impermissible uses or disclosures that are not allowed by the rule, certify compliance by their workforce. And covered entities should rely on professional ethics and best judgment when considering requests for these permissive uses and disclosures. The HSS Office for Civil Rights enforces HIPAA rules and all complaints should be reported to that office. The HSS Office for Civil Rights enforces HIPAA rules and all complaints should be reported to that office. HIPAA violations may result in civil, monetary or criminal penalties. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.